That is, the death toll in Italy has risen by 919 and now stands at 9,134.
Yes, Mark, I can't quite believe we're seeing these numbers. 919 people have lost their lives in the last 24 hours in Italy. That is by far the biggest loss of life in a 24-hour period, not just in Italy, but globally. If I'm not mistaken, the biggest loss of life in a single day in Italy so far before this figure was 765. I'll need to check that to be sure, but it was around that. So 919 is a huge leap. And to think that it was just the 21st of February, exactly 5 weeks ago today, that Italy lost its first citizen to COVID-19, and the number now stands at 9,134 lives lost in just 5 weeks.
Last time we showed you unsettling pictures of nurses in a New York City hospital wearing garbage bags because of what they called the lack of protective clothing. Hospital and government officials said that was not the case, but now one of their colleagues is stepping forward to confirm their story, saying she's risking her job in doing so.
This distraught nurse says she's putting her job on the line, speaking out today in support of 3 colleagues photographed wearing garbage bags, a picture that sent shockwaves across the USA.
There are nurses in the hospital that are struggling and crying and running crazy.
Diana Torres, a nurse at Mount Sinai West, the Manhattan hospital where the photo was taken, is speaking out.
Help has arrived. The 900-foot US NS Mercy ship sailed into the port of Los Angeles Friday morning. The former oil tanker has been converted and armed with 1,000 beds, doctors and nurses, and a mission: relieve Los Angeles hospitals, many of which may soon be overwhelmed. Every patient to be treated here will be thoroughly screened for COVID-19 before being admitted. The Mercy will only accept patients who test negative, leaving the hospitals in the city to focus on patients suffering from the virus. Here in Los Angeles, around 90% of beds are already in use in hospitals, and with the number of cases increasing rapidly, this ship will free up major resources such as ventilators and intensive care beds.
And we're going to be in very good shape in terms of certain equipment that's very hard to get, very hard to manufacture, and at the right time we'll be distributing that equipment throughout the world to other countries. Boris Johnson was asking for ventilators today. As you know, he's tested, unfortunately, he's tested positive, and it's a terrible thing. But he's going to be great. I'm sure he's going to be totally great. But they want ventilators. Italy wants ventilators. Spain wants ventilators. Germany wants ventilators. They're all calling for ventilators. Well, we're going to make a lot of ventilators so we can make them. And if we don't need them, John, that's okay, because we can help Italy and we can help UK, Boris Johnson specifically. I mean, when I say, how are you feeling? And the first thing Boris said to me is, we need ventilators.
A mammoth pandemic plan for the U.S. costing more than $2 trillion is now law. President Trump had already signed it, and he ordered a major automaker to start building ventilators. He also authorized calling up military and active National Guard reserves to duty. Now that came as U.S. infections topped 100,000, the most anywhere in the world, with more than 1,500 deaths. But there's also a need for medical support. Take a look.
This is the really bad news. The number of deaths is increasing. It's bad news because people are dying, and that's the worst news you can have. It is not bad news in terms of it being unexpected.
The number of COVID-19 cases has gone well over 500,000 across the world. The U.S. has now reported more than 100,000 cases.
Tommy, the U.S. now has more cases than any other country in the world, with over 100,000 confirmed cases. The pandemic is accelerating in the U.S. as COVID-19 cases doubled in just 3 days. The death toll has reached over 1,500. New York remains the worst hit state in the country, accounting for almost half of the entire figure, with at least 44,000 confirmed cases. President Trump has taken urgent measures to cope with a shortage of medical supplies on Friday.
The healthcare situation is difficult. The death toll over the past 24 hours is very high, and we have to admit that this is a crisis that is going to go on and on. It's not going to get better quickly. We have to hold on and to stay mobilized. The wave of cases that are spreading across France hit the east of the country first and have now arrived at the Île-de-France and in other regions of France at an extremely fast pace, and it's putting the healthcare system under great strain.
As the corona crisis spreads, migrants attempting to enter Europe are in a vulnerable position, with little or no help. Just under a week ago, 56 people arrived on the Greek island of Lesbos. The country is on lockdown, but the migrants complain they've been given no protection. The UN office on Lesbos described the camp living conditions as inhumane. Last month, neighbouring Turkey said it would no longer stop migrants from heading towards Greece. The result is a border crisis between the two historic rivals. Greek authorities have said no migrants who arrived after March the 1st will be able to apply for asylum. Instead, they'll be detained pending deportation.
Just a month ago, China was reeling from the COVID-19 epidemic. The country was in lockdown, its economy was in the deep freeze. At home and abroad, the government was accused of a cover-up that allowed the virus to spread and grow into a pandemic. Global rivals were quick to criticise. How different it all looks now. While the US braces for the worst to hit, back in Wuhan, where it all began, Chinese authorities have lifted lockdown and are claiming community infection has ended. The wheels of industry are beginning to turn again. And everywhere you look in the world, Chinese aid and virus-fighting expertise is on the move. Some call it pandemic diplomacy. And there are no shortage of takers. This medical aid is arriving in Manila, a traditional US ally.
The health authorities would say that, yes, this is a record rise in the death toll, because 832 compares to the record yesterday of 769 deaths. But they would look very carefully at the percentage rise, which they say is coming down slightly. Yesterday, the death toll was up by 15%. Today's figure up by 15% compared to yesterday's rise of 18%. They would also draw our attention to the rise in the number of people affected and say that that is slightly falling as well. It's gone from 14% to 11%.